Phlebotomy Chapter 4, Pre-examination variables and venipuncture complications. Pre-examination and pre-analytical variables. Factors associated with patient's activities before specimen collection. Affects the quality of the specimen and test result. Be aware of activities. Most errors that occur often happen during blood collection. Examples of pre-examination or pre-analytical variables are diet, posture, exercise, stress, medications, alcohol, time of day, smoking, altitude, age and gender, pregnancy, dehydration, and fever. The basal state. The ideal time to collect a blood specimen is early in the morning. Reference ranges for laboratory tests are determined from a normal sample of volunteers who are in a basal state. Diet. The patient should be fasting for 8 to 12 hours. It's the phlebotomist's responsibility to ask the patient when was the last time they ate. Glucose. Lipids. Lipemia interferes with many lab procedures. Posture and exercise. Posture. Changes in high molecular weight compounds between supine and erect position. Exercise. Effects depend on physical fitness, muscle mass, intensity of exercise, time between exercise and blood collection. Prolonged exercise increases aspartate aminotransferase, creatine kinase, lactic dehydrogenase, and hormones. Stress, smoking, and altitude. Stress causes increased white blood cell counts and hormone levels. Smoking causes glucose and blood urea nitrogen levels to increase by 10% and lipids to increase by 20%. Chronic smoking increases red blood cell count, hemoglobin, and mean corpuscular volume, MCV. Altitude increases red blood cell count, hemoglobin, hematocrit, C-reactive protein, and uric acid. Age and sex affect changes in cell counts and hormone levels. Red blood cell, hemoglobin, and hematocrit levels are higher in males. Red blood cell and white blood cell levels are higher in newborns. Always confirm the age or date of birth and sex of a patient. Pregnancy. Physiological changes, increased plasma volume, lowers normal reference ranges. Other factors influencing patient test results: shock, malnutrition, dehydration, fever, burns, and trauma. Diurnal variation. Normal fluctuations of blood levels of certain analytes at different times of the day. Analytes affected are cortisol, bilirubin, hemoglobin, other hormones, and serum iron. Timed collections. Must be collected at specified times. Medications. IV administration of dyes used in radiological procedures can interfere with tests. You must be aware of any procedures performed at the time you are collecting a specimen, and it must be noted on the requisition form. Prescription and over-the-counter drugs can affect lab test results. Common medications affecting lab tests. Acetaminophen and certain antibiotics can affect liver enzymes and bilirubin levels by elevating them. Aspirin, salicylates, and herbal supplements can cause prolonged PT and bleeding time. Cholesterol-lowering drugs can prolong PT and APTT. Certain antibiotics can cause elevated BUN and creatine levels and electrolyte imbalance. Corticosteroids and estrogen diuretics can cause elevated amylase and lipase. Diuretics can cause increased calcium, glucose, and uric acid levels, and decreased sodium and potassium levels. Chemotherapy can cause decreased red blood cells, white blood cells, and platelet levels. Radiographic contrast media can cause changes to routine urinalysis. Fluorescein dye can cause increased creatinine, cortisol, and digoxin levels. Opiates can cause increased liver and pancreatic enzyme levels. Oral contraceptives can cause decreased apoprotein, transcortin, cholesterol, HDL, triglycerides, LH, FSH, ferritin, vitamin B12, and iron levels, can elevate erythrocyte sedimentation rate. Technical complications. Procedural errors with venipuncture technique can cause inability to obtain blood. Fixing the situation can prevent an additional puncture to the patient. Errors in technique that can cause injury to the patient are selecting high-risk venipuncture sites, using an excessive angle of needle insertion, excessive manipulation of the needle. Failure to obtain blood. Complications could include failure to anchor the vein, needle beside the vein, bevel against the vein wall, incorrect angle of needle insertion, under 15 or over 30 degrees, collapsed veins, faulty evacuated tube. You may use no more than 2 attempts. Remedies to inability to obtain blood. Adjusting the position of the needle, rotating the bevel of the needle, using short draw evacuated tubes, pulling back on the needle more slowly, no probing, having extra evacuated tubes on hand. To remedy the bevel against the wall of the vein. This complication means that the needle angle is too shallow, which can cause the needle to lay against the upper wall of the vein. You should pull the needle back and redirect the needle. If you've entered the vein with the bevel down, rotate the needle 45 degrees. Needle too deep. Needle angle is greater than 30 degrees. Advancing a tube onto the tube stopper needle when the tube holder is not firmly braced against the patient's skin. Needle may penetrate through the vein into the tissue. Hematoma can form. Gently pull the needle back. Needle too shallow. Needle angle is less than 15 degrees. Bevel of the needle may only be partially in the vein. Can cause hematoma. Slowly advancing the needle into the vein may correct the issue. If a hematoma forms, remove the tourniquet and needle immediately and apply pressure to the site. Collapsed vein. Using an evacuated tube that is too large. Pulling back on the plunger of the syringe too quickly. Applying a tourniquet too tightly. A vein that disappears when the tube is pushed onto the back of the evacuated tube system needle is usually a sign the vein collapsed. Spray of blood into the tube appears and then stops flowing. Needle beside the vein. A vein that is not well anchored is a frequent reason for failure to obtain blood. Gently touching the area around the needle with your gloved finger may help you determine the position of the vein so you can redirect the needle. Redraw the needle until the bevel is just under the skin, anchor the vein, and redirect the needle. The Clinical and Laboratory Standards Institute, or CLSI, recommends never moving the needle in a lateral direction across the basilic vein due to the close proximity of the brachial artery and brachial nerve. If the needle appears to be in the vein, but blood flow is slow or absent, try using a new tube before discontinuing the venipuncture. Always have extra tubes within reach. Collection attempts. If the initial blood draw is unsuccessful, select another site in the other arm or right below the previous site. Use a new needle. If second attempt is unsuccessful, ask another qualified person to perform the venipuncture. Specimen collections following rigorous probing are frequently hemolyzed and must be recollected. Hematomas. Skin discoloration and swelling. Renders site unusable for future venipuncture. Exerts pressure on the nerves in the area that can lead to a disabling compression nerve injury. Caused by improper techniques such as failure to remove tourniquet, inadequate pressure and bending the arm, probing, faulty needle insertion, using too large a needle, accidental arterial puncture, fragile or small veins. injury to surrounding tissue. If a hematoma starts to form during blood collection, immediately remove the tourniquet and needle. Apply pressure to the site for 2 minutes. Apply pressure for 3 to 5 minutes for accidental arterial puncture. Offer a cold compress to the patient for the first 24 hours. Follow facility policy. Compartment syndrome. Blood accumulates within tissues of muscles. Builds pressure. Interferes with blood flow. Causes muscle injury. Symptoms are pain, swelling, numbness, permanent injury to nerves. Requires surgery to open the compartment to relieve pressure. Nerve injury. Most critical permanent injury is damage to the median antebrachial cutaneous nerve. Patient will experience burning sensation or electric-like shock sensations, shooting pain, tingling or numbness running up or down the arm or fingers. Remove the tourniquet and needle immediately. This can be caused by incorrect vein selection, underside of wrist or basilic vein, jerky movements, inserting the needle too far, patient movement while the needle is in the vein, lateral redirection of the needle, blind probing, excessive manipulation of the needle, may lead to lawsuit. Iatrogenic anemia. Blood loss caused by treatment. High blood volume removed by venipuncture. Most affected are pediatric, elderly, or critically ill patients. Taking more than 10% of the patient's blood can be life-threatening. Minimum amount of blood should be obtained. Monitoring for duplicate collection requests and avoiding redraws can reduce excessive blood collection. Hemolyzed specimens. Most common pre-examination or pre-analytical error. Presence of pink or red plasma. Venipuncture technique. Processing, handling, transporting. Physiological, metabolic disorders. Can be caused by using a small gauge needle and a large tube. Loose syringe needle. Pulling back the syringe plunger too rapidly. Drawing from a hematoma. Vigorous mixing. Forcing blood from a syringe into a tube. Collection of specimens from IV lines. Placing tourniquet too close to the puncture site. Tourniquet was applied for too long. Fragile veins. Alcohol not dry. Blood collected through catheters. Partially filled sodium fluoride tubes. Readjusting the needle in the vein. Factors in processing, handling, and transport. Rimming clots. Prolonged contact of serum or plasma with cells. Incorrect centrifugation speeds. Elevated or decreased temperatures of blood. Pneumatic tube systems. Unpadded canisters, speed acceleration or deceleration, excessive agitation. Physiological factors. Anemias, mechanical valves, blood microorganisms, medications. Tests affected by hemolysis. Those that are seriously affected are potassium, lactic dehydrogenase, or LD, aspartate aminotransferase, or AST, complete blood count, or CBC, troponin. Noticeably affected tests are serum iron, alanine aminotransferase, or ALT, thyroxine, or T4, prothrombin time, or PT, APTT, C-peptide, and creatine kinase. Slightly affected tests are phosphorus, total protein, albumin, magnesium, calcium, alkaline phosphatase, or ALP, rapid plasma reagin, or RPR, bilirubin, and haptoglobin. Specimen contamination. Affects integrity of specimen and leads to invalid test results. Causes of contamination include edema, hematomas, IVs, alcohol or iodine, anticoagulant carryover, and infected sites. Tube problems. Tube pops off the back of the holder. Maintain pressure on the tube. Needles detach from the holder. Reflux can cause adverse reactions in the patient. Keep the patient's arm in a downward position. Partially filled collection tubes. Incorrect ratio of blood to anticoagulant. Partial draw tubes may be more suitable. Patient complications. Fainting or syncope. Anticipate and be prepared to react. Do not use ammonia inhalants. Patient may be asthmatic. Monitor for symptoms: paleness of skin, hyperventilation, lightheadedness, dizziness, vertigo, nausea, warm or clammy skin. Remove tourniquet and needle immediately. Patients frequently mention previous adverse reactions. If such patients are sitting up, it may be wiser to have them lie down before collection. It is helpful to distract the patient through conversation during blood collection. If a patient faints during a blood collection, remove the tourniquet and needle immediately. Apply pressure to the site. Lower the patient's head. Use a cold compress. Instruct the patient to take deep breaths and document the incident. Seizure. Remove the tourniquet and needle immediately. Apply pressure to the site. Summon for help. Do not place anything in the patient's mouth. Document the start and end times. Petechiae. Apply additional pressure after needle removal. This condition will present as tiny round brown spots due to bleeding under the skin. Allergies. Check with the patient. Nausea and vomiting. Provide emesis basin. Instruct patient to breathe slowly and deeply. Apply cold compress to the forehead. Stop blood collection immediately if the patient starts to vomit. Causes of specimen rejection: unlabeled or mislabeled specimen, inadequate volume, wrong tube, hemolysis, lipemia, clotted anticoagulated specimen, improper handling of the specimen, no requisition form, contaminated containers, delays in processing, and outdated tubes. Chapter 4 from the book: Pre-examination, Pre-analytical variables, and Venipuncture complications. Key terms: basal state, metabolic condition after 12 hours of fasting and lack of exercise. Compartment syndrome, blood accumulates within the tissue of the muscles that surround the arm or hand and causes increased pressure in the area. Diurnal variation, normal changes in blood constituent levels at different times of the day. Fasting, abstinence from food and liquids except water for a specified period. Hematoma, discoloration of the skin or bruise produced by the leak of blood into the tissues. Hemolysis, destruction of red blood cells. Iatrogenic, pertaining to a condition caused by treatment, medications, or diagnostic procedures. Lipemic, pertaining to turbidity of serum or plasma appears cloudy from increased lipid content in the blood. Reference ranges, test results within normal limits or normal values. Petechiae, small red spots appearing on the skin. Pre-examination or pre-analytical variable, process that occurred before collection of a specimen. Syncope, fainting. Vasovagal reaction, pertaining to the action of the vagus nerve on the blood vessels that affects blood vessel dilation and heart rate and causes fainting. The pre-examination or pre-analytical stage of lab testing involves processes that occur before testing of the specimen. Errors that occur during this stage often happen during blood collection. The basal state. The ideal time to collect blood from a patient is when he or she is in a basal state. This is early in the morning when the patient has refrained from strenuous exercise and has not ingested food or beverages except for water for 12 hours. Reference ranges or normal values for lab testing are determined from a normal representative sample of volunteers who are in the basal state. The tests most affected by the ingestion of food and beverages are lipids and glucose. Glucose levels increase after a meal and return to normal within 2 hours. Serum or plasma collected from patients shortly after a meal may appear cloudy or turbid or lipemic because of the presence of fatty compounds such as meat, cheese, butter, and cream. Lipemia will interfere with many laboratory procedures. Certain beverages can also affect laboratory tests. Alcohol consumption can cause a transient elevation in glucose levels, and chronic alcohol consumption affects tests associated with the liver and increases triglycerides. Caffeine has been found to affect hormone levels, whereas hemoglobin levels and electrolyte balance can be altered by drinking too much liquid. Non-fasting specimens can increase glucose, triglyceride, aspartate aminotransferase or AST, bilirubin, blood urea nitrogen or BUN, phosphorus, uric acid, growth hormone, cholesterol, lipoproteins, and low-density lipoproteins. Prolonged fasting can have increased bilirubin, ketones, lactate, fatty acids, glucagon, and triglycerides, and decreased glucose, insulin, cholesterol, and thyroid hormones. Posture can cause increased albumin, aldosterone, bilirubin, calcium, cortisol, enzymes, cholesterol, HDL, potassium, total protein, triglycerides, red blood cells, white blood cells, thyroxine or T4, plasma renin, serum aldosterone, and catecholamines. Stress can cause increased aldosterone, catecholamine, cortisol, fatty acids, lactate, potassium, renin, thyroid-stimulating hormone, growth hormone, prolactin, PO2, and white blood cells, and decreased serum iron and PCO2. Caffeine can cause increased fatty acids, hormone levels, glycerol, lipoproteins, and serum gastrin. Smoking can cause increased glucose, BUN, triglycerides, cholesterol, GH, alkaline phosphatase or ALP, catecholamines, cortisol, IgE, hemoglobin, hematocrit, red blood cells, and white blood cells, and decreased immunoglobulins, IgA, IgG, and IgM. Altitude can cause increased red blood cells, hemoglobin, hematocrit, C-reactive protein, and uric acid, and decreased urinary creatine and plasma renin. Age can cause increased cholesterol and triglycerides and decreased hormones. Pregnancy can cause increased protein, ALP, estradiol, free fatty acids, iron, and red blood cells, and decreased erythrocyte sedimentation rate and factors 2, 5, 7, 9, and 10. Dehydration can cause increased calcium, coagulation factors, enzymes, iron, red blood cells, and sodium and potassium. Diurnal variation can cause increased cortisol, testosterone, bilirubin, hemoglobin, insulin, potassium, renin, red blood cells, TSH, LH, follicle-stimulating hormone, estradiol, aldosterone, and serum iron, and decreased eosinophils, creatinine, glucose, phosphate, and triglycerides. Posture. Changes in patient posture from a recumbent or lying down position to an upright position can cause variations in some blood constituents, such as cellular elements, plasma proteins, compounds bound to plasma proteins, and high molecular weight substances. The large size of these substances prevents their movement between the plasma and tissue fluid when the body position changes. For example, protein-bound compounds are too large to pass through the capillary walls and remain in the bloodstream. Therefore, when a person moves from a recumbent to an upright position and water leaves the plasma to efflux into the tissue, the concentration of these high molecular weight substances increases in the plasma. The concentration of these analytes can increase 4 to 15% within 10 minutes after changing from recumbent to standing. After the patient returns to recumbent from a standing position, it takes about 30 minutes for the analytes to decrease to the original level. Plasma renin, serum aldosterone, and catecholamines can double in 1 hour. Therefore, patients are required to remain recumbent for 30 minutes before blood collection. This increase is most noticeable in patients with disorders such as congestive heart failure and liver disease that cause increased fluid to remain in the tissue. Chapter 4 Review Questions. 1. When blood is not obtained after needle insertion, gently pulling the needle back and redirecting it in a forward motion is an acceptable technique. 2. Potassium is most critically affected in a hemolyzed specimen. 3. When a patient develops syncope, the first thing you should do is remove the tourniquet and needle. 4. A patient verbalizes a shooting, burning, and tingling pain when the needle is inserted. This could be caused by a nicked nerve. 5. Using a needle with too small of a diameter could cause a hemolyzed blood specimen. 6. Clots in a lavender stopper tube would cause a lab to reject the specimen. 7. A shallow needle insertion angle could cause blood to begin to flow slowly into the tube while leaking into the tissue and cause a hematoma. 8. A patient is scheduled to have a blood specimen drawn at 8 a.m. and again at 1600. The reason for these instructions is that the specimen being drawn exhibits diurnal variation. 9. Having the patient bend his or her elbow and applying pressure can cause a hematoma. 10. Decreased glucose is caused by prolonged fasting. Increased hemoglobin is caused by altitude. Increased white blood cells is caused by stress. Increased creatine kinase is caused by long-term exercise.